Welcome to Queen Victoria Hospital and our patient information video on axillary blocks. This block is used to allow you to undergo hand or forearm surgery comfortably without the need for a general anaesthetic. It also gives you long-lasting pain relief without the need for strong painkillers after your operation. You will be brought into the block room and asked to lie down on a trolley with your arm out on a table. A tiny needle or cannula will be placed in your other hand. This is sometimes used to give you antibiotics or other drugs if required. Some routine monitoring devices will be attached to you, including a heart rate monitor, blood pressure cuff, and a probe on your finger to measure your oxygen levels. We will then clean the skin around your armpit with an antiseptic solution. A small amount of cold, clear jelly will be put on the skin to allow us to see inside your arm with an ultrasound beam. At this point, the lights are usually dimmed to allow us to see the structures in your armpit and locate the nerves that need blocking in order to ensure your surgery is comfortable. Once we are happy that we have seen the nerves, we will use a tiny needle to numb the skin over our chosen site. This sometimes stings for a few seconds. We will then insert the slightly larger block needle. However, because the skin is numb, this should not feel sharp. During the block, you should not feel pain, but you will feel pushing and pressure as the needle is advanced. The anaesthetist will guide the needle under direct ultrasound vision to the nerves that require blocking. They will then inject a small amount of local anaesthetic around the nerves that gives sensation to the hand and arm. There are usually 4 separate nerves that need to be numbed by the local anaesthetic. It usually takes between 10 to 20 minutes to complete the procedure. Once completed, you will start to feel your hand becoming warm and then develop a pins and needles sensation. It will become increasingly numb and heavy. Usually it will take 10 to 30 minutes for your arm to be numb enough for your surgery. During this time, we will sit you up and use your gown to act as a sling to hold your arm still and protect it. Once we are happy with the block, you will be transferred to the operating theatre for your operation. On arrival in the theatre, you will be connected to our routine monitoring equipment. A final safety checklist will be performed. Your arm will then be cleaned and covered in a sterile drape. You may be able to feel movement and touch of your hand or arm during the procedure, but this is entirely normal. You should not experience any pain. You will have a member of the theatre team with you at all times should you need any assistance. We hope that this video has been both useful and helpful in alleviating any worries you may have had about the procedure. If you require further information, please refer to our patient information leaflet on axillary blocks or speak to your anaesthetist, who will be happy to discuss matters with you further. Thank you for watching.